to Sweet Child of Mine introductory video. If you are watching this, you are likely interested in more information about our services and how our program works. Hi, I'm Kim Bernard, and I'm the founder of Sweet Child of Mine. I function as the clinical director and one of the staff midwives. We welcome you to Sweet Child of Mine. Sweet Child of Mine has been serving the community since 2009. Since 2014, we've been licensed as a birth center in Brandon, Florida. Sweet Child of Mine offers full-service prenatal care, labor and delivery at the birth center facility, water birth, nitrous oxide, lactation services, doula services, and postpartum care. Our philosophy is to unite the best of modern science and medicine with the natural roots of birthing the way nature intends. We know that the idea of birthing outside the hospital is a new concept for many people and can seem unusual at first. However, when you think about it, birthing in the hospital is a relatively new thing. It wasn't until about 80 to 90 years ago that birth in the hospital became normalized. We also recognize that science has improved medical care in so many ways during the last century. All of these things are a blessing when they are needed. However, when interventions are utilized unnecessary, they can cause complications. The United States spends more on birth than any other country in the world, but believe it or not, we have the highest rate of infant and maternal mortality in the developed world and even some third world countries. I believe this is largely due to how we do birth in the United States, which is actually quite different than Europe and most of the developed world. We've gone too far with our interventions, inductions, medications, and surgical deliveries, and we've neglected the foundations of good health. Since birth is a natural and normal process for low-risk women, our goal is to follow the natural body process, to recognize the difference between normal and abnormal, and to intervene only when necessary. As midwives, we serve low-risk women and babies. If you have not already, we will have you complete a risk assessment form to determine if you're low risk and eligible for care. Many women may think they're high risk due to their age or weight or other factors. However, this may not be the case. We can adapt your care to include any additional tests and ultrasounds that you may need, and you can still deliver at the birth center. As midwives, we focus on preventative care. Nutrition and exercise are very important to us because we want you and your baby to stay healthy. We will often make suggestions for natural remedies for common discomforts, and we do have prescriptive privileges if you need a prescription for anything throughout your pregnancy. We take a personalized and sensitive approach to your care. Our appointments are longer, and you build a relationship with your midwives throughout the course of your care. We cater all of your medical care and birth to your wishes and individual needs. The healthcare decisions are in your hands, so we will give you the full education you need to make the decisions that are right for you. While we offer all of the industry standard testing, if there is a test that you would like to decline or request, please let us know. Our philosophy is to make birth not just a medical procedure, but a beautiful experience for you and your family. We welcome your family and your children to participate in your birth as you would like. If you and your partner would like to catch your baby, you can do that. We recognize that this is one of the most important days of your life, and we honor that with the utmost respect. We view every birth as a sacred event and want to make it the best experience possible. So once you've gone through the risk assessment process, have toured our facility, and have decided to come into care, this is what you can expect. You will have regular prenatal visits throughout the course of your pregnancy. Through your visits, you will meet each of our midwives and develop a relationship with them. In the beginning, your visits are every 4 weeks. Then in the 3rd trimester, you will have prenatal visits every 2 weeks and weekly in the last month of the pregnancy until you deliver your baby. The safe range to deliver out of the hospital is between 37 weeks and 42 weeks. We want to make sure your baby is full term and lungs are well developed. At your visits, we do all the standard things like check your blood pressure and weight, dip your urine, checking for protein and infections, measure your uterus, and listen to the baby's heartbeat. Then we talk about various topics to get you ready for the birth, breastfeeding, parenting, and all the decisions that you need to make as new parents. So I want to take a minute and talk about early pregnancy care. In some cases, it's good to have early labs and an early ultrasound to determine that everything is going normal in your pregnancy. If you are over 35, you have a history of miscarriages or ectopic pregnancy, we recommend that you contact us as soon as you are pregnant for early lab testing and an early ultrasound. Early lab testing can be done as early as 5 to 6 weeks pregnant, and we recommend having an early ultrasound at 7 to 8 weeks gestation. This is especially important if you have irregular cycles or you don't know your dates. This will help us get an accurate due date for you. We can check your HCG and progesterone levels to determine if you are deficient in progesterone and if the pregnancy is progressing normally. If you are deficient in progesterone, we can prescribe you a prescription. Our first normal prenatal visit is usually between 10 and 12 weeks because this is when we can hear the baby's heartbeat with the Doppler. We do our lab draws in-house, and our ultrasounds we send to an imaging center or to the hospital for a level 2 ultrasound. We do this because we want to have a radiologist or a doctor read the report for us. We do have a small portable ultrasound machine in the office to determine the baby's position or to check an early heartbeat. When you schedule your first prenatal visit, we will set you up in our electronic health record system where you can actively interface with your medical records, see your lab and ultrasound results, and message the midwives with any questions that you may have between your appointments. The midwife on call is always reachable at extension 2, so if you ever have any concern that is medically urgent, you can call us day or night to have your concern promptly addressed. We have our own unique childbirth education program that is geared specifically toward birthing out of the hospital. This set of 4 classes is required, and we recommend that you take them in the 5th, 6th, or 7th month of your pregnancy. We offer them at several different times, and there is also a more condensed refresher course for those who have experienced natural birth before. So now we're getting to the exciting part, the big day. You're in labor and you call the midwife on call at extension 2. When you're in active labor, you come into the center and we admit you. The midwife will monitor you and the baby throughout the labor using a handheld Doppler that's waterproof. We encourage you to move around as you'd like in labor, eat and drink in labor. We don't do routine IDs, just for special situations. You can have whoever you'd like with you at your birth, and pictures and video are fine. Water births are a highlight of our facility. Approximately 60% of our births are in the water. The water is very relaxing for labor and works to decrease the discomfort of labor by 50%. The shower is also very helpful, and we have instant hot water heaters, so you will never run out of hot water. We also offer nitrous oxide in labor. Nitrous oxide is a 50-50 mix of nitrogen and oxygen, similar to what is commonly known as laughing gas. This is self-administered by mask and helps with relaxation, anxiety, and pain. We also use a myriad of other natural therapies to help you in labor, including essential oils, heat application, pressure points, reflexology, massage, position changes, birth stools and yoga balls, and special exercises and movements to help get the baby in a good position. So after your baby is born, your baby will be placed on you, and your baby will stay with you so important for breastfeeding initiation and bonding. We do delayed cord clamping. That means we wait till the cord stops pulsing to cut the cord. This usually takes about 5 to 10 minutes. As long as your placenta is still attached to the side of your uterus, your cord will still pulse. When the baby's born, about 25 to 30% of their blood volume is outside of their body, in the cord and in the placenta. If you leave it intact, the baby will get most of that blood. This is very important for oxygen levels in the first few minutes and the strength of the baby's immune system and prevention of anemia. About an hour or so after the birth is when we do the full newborn exam. This is when we weigh and measure the baby and check all the reflexes. Usually mom eats while we do this, and then you can dress the baby together. Mom will get up to take a shower, and then we'll give you your discharge instructions. If you need stitches, we have lidocaine for numbing, and we can do suturing. The average day at the birth center is usually about 4 hours after the birth. We will see you back within a couple of days after the birth for additional follow-up. Our standard postpartum visits are at 2 weeks and 6 weeks, but we are always here for you and we'll see you extra for lactation support and any issues that you may have. You will choose a pediatrician and we will give you referrals. The baby will see the pediatrician that you choose within 2 days after the birth. Our transfer rate in labor is very low, ranging between 5 and 10%. We are fortunate to have a hospital very close to us, just a half a mile away. We also have a collaborative relationship with another hospital, which makes transfers very smooth and easy. When you come in to tour our facility, we welcome you to ask any additional questions that you may have. We are always here to help you with anything